my toothpaste has salt in it.
Yeah.
So like, is it beneficial?
No, things like it's polishing off your tooth.
Okay.
And
so
that
they're
can
damaging.
Over time, it damages the teeth. It causes sensitivity. Yeah.
How much does a dentist make in a month in Canada?
So overall, from what I can see, it's not too bad.
So good morning, guys. Welcome back to the channel.
One second.
So good morning, guys. Welcome back to the channel. Today I'm in a dentist clinic. You can see the title. So this video is gonna be in English. Usually I make like videos in Hindi. So I'm gonna try to put some Hindi thing too.
Okay.
Just fine. Like when we do the conversation, I'm trying to do some summary.
Okay.
So हम आज तुम्हें बताएंगे कि dentist job क्या होती है कनाडा में. I'm gonna do a brief description. I have a lot of questions written down. तो मेरे पास बहुत सारे क्वेश्चन लिखे हुए हैं तुम्हें हेल्प करने के लिए और मैं बहुत मेहनत कर रहा हूँ तुम देख सकते हो. I'm struggling to do the Hindi and English. So as you guys can see and understand that. So first of all, you can like the video and share it with your friends who want to come to Canada and would like to see this job. First, we're gonna start with introduction.
Sure.
Okay, so Jordan, what's your name and age? Oh, sorry, I already told your name.
Yeah, my name is Jordan. So Dr. Galpin, I'm 34 years old. I'm born in Vancouver, so I'm a local here. And I did my dental degree at the local university here, the University of British Columbia.
So let's start with the job. What is a dentist and what is their job?
What does a dentist do? A dentist is responsible for taking care of patients' oral health. So when a person hears the word dentist, they often think teeth, and that's definitely a big part of what we do. A lot of people might not realize that a dentist also looks for things like oral cancer.
Okay, so you guys are like a caretaker of teeth.
Yeah, a caretaker of teeth. That's a nice way to say it. Yeah.
I have a second question, which should be a last question, but I want to start it with this.
Sure.
Why is dental so expensive? Like in Canada, I know it's too expensive, but likewise in India, it is expensive too.
Oh, is that right?
Yeah, compared to other things like eye care and dental is considered really expensive.
Quite pricey. Yeah.
Same like here, right?
That's a good question. Dentistry, I think, is expensive just because a lot of the components of dentistry are really expensive. So if you compare a dental office to maybe an optometrist, an eye doctor, or a family doctor, a lot of the equipment that we use is pretty pricey. So to set up a dental office is a lot more expensive than to set up most other physician offices.
Okay.
So things like the chair can be like $70,000 to $80,000.
Wow.
You're paying a lot for the X-ray machines, digital scanners. All of this takes a big kind of financial hit. And in order to be able to afford that, you know, the fees have to go up. Those employees.
Okay, so it all adds up. The inventory is too expensive.
Yeah.
And also, like, you have to hire a staff and everything adds up.
Yeah, exactly.
So that's why it is so expensive.
Yeah.
So maybe it's fair. Yeah.
Yeah.
Okay.
I mean, I think it's fair.
Yeah, obviously you should do. Okay, so let's go now with how to become a dentist. Like, how to become
That's a great
dentist.
question. So in Canada, you need to do either 3 or 4 years of an undergrad degree. So depending on where you are, your path to getting into dentistry is different.
So this is the process. First you have to do a bachelor's and then this is like a master's degree.
Yeah, and there's an exam that we write to apply.
So estimately how many years does a person need to study after high school?
To become a dentist?
Dentist, yeah.
4-year undergrad, and then all the dental schools in Canada, I believe, are 4 years as well. So you're looking at 8 years.
8 years,
yeah.
Okay. So next thing I would ask, like, this is like a very basic question.
Yeah.
Which is like how to brush your teeth.
How to brush your teeth.
Yeah.
That's a great question.
What is the like best way to brush? Because everybody brush their teeth, but I think most of the people don't know how to brush.
Yeah.
Maybe I don't know.
I'll try and give you a couple of general guidelines.
Okay.
Keep in mind that what we recommend varies depending on the patient's needs and what's in the mouth. Okay. So for example, what we recommend for a child is different with an adult or with a senior. And if you have certain things in the mouth, we might recommend different techniques.
Okay.
So with that in mind, if you're brushing and you're brushing with a manual toothbrush, so not an electric, generally we recommend trying to do circular motions and trying to get the bristles of the toothbrush up and in between the gum line.
Okay.
Doing that, a big part of keeping the mouth healthy is keeping the gums healthy.
Okay.
A lot of people, when they brush, they just focus on scrubbing the teeth.
Everybody's like doing so hard of it.
Yes, side to side with a lot of force. That can damage the teeth and damage the gums.
Yeah.
Pushing, I always tell patients, pushing is not going to help kill the bacteria. It's not going to help kill or destroy the kind of gunk. All it does is damage the tooth and damage the gums.
Okay.
When you're brushing, it's all about breaking up the party. The bacteria are trying to get together, you want to break that up. And with soft circular motions, you can do that. Okay? And with an electric toothbrush, it does the work for you. So all you got to do is hold it and get it around each individual tooth and not push too hard. Electric toothbrush, if you're pushing too hard, because it's doing so many rotations per second, it can do a lot of damage. So I love electric toothbrushes. That's generally what we recommend to patients, but you just got to be careful, not too much force.
Not too much force with electric. So you recommend the electric toothbrush?
I do for most patients,
Okay.
yeah, because it just makes it easier to get all the nooks and crannies and get everything clean.
The stocks after this watching like of the electric toothbrush will go up and up. Like dentist saying you should definitely go. And also people are gonna watch this in India, so maybe you should invest in the electric toothbrush stocks. Okay, so this is like a personal question, but obviously I'm gonna put that in video. What do you think is the health of my teeth?
Well, I gotta take a look. You gotta get in the chair.
How long will it take? Can we do that for like the video?
You don't mind it being on the video?
Yeah.
And I'm happy to take a look.
Okay, let's see.
But you'll have to pause it and let Mandy do a cleanup, okay?
Okay, yeah, sure. We can wait. No problem.
Mandy, Mandy will set it up for a spec exam. I'll take a look.
तुम्हें क्या लगता है कैसे होंगे भाई किडी? Comment करके
Set the
बताओ.
room up, okay?
Okay, sure.
Yeah. Good.
All the best to me.
Yeah. Yeah.
That's good.
Perfect.
Okie dokie. Let's take a look. See. You excited? When was the last time you saw a dentist?
I was just telling Mandy about it. I saw it when I was like a child.
When you were a child?
Yeah, we used to go on a school tour.
You sure you want this on camera?
I'm scared too, I know, but it's fine.
Okay.
I can cut it. It's my
You
footage,
can cut
right?
it. Okay, we're not live streaming. That's good.
Okay, yeah, we're not like.
Yeah, you can cut it. That's
Yeah.
fine.
Okay.
I'll just put the best part when you say, yeah, they're fine, but it can be better.
They're fine.
Let's go, guys.
Okay. Yeah. Okay, so overall, from what I can see, it's not too bad. The big problem is the decay on those upper teeth.
So as we were doing the process, I was seeing like we were putting so much air in the mouth. What
Yeah.
was that for?
So your teeth are obviously covered with saliva.
Okay.
So if we're trying to take a photo or to show you something, the saliva gets in the way and you just can't see it.
Okay, makes sense.
So I get Mandy or get the assistant to just blow a lot of air so it's nice and dry so you can kind of see what we're talking about.
Yeah.
So there, can you see that?
Oh,
So I put a probe into it just so you can see, you know.
okay, so
Yeah,
let's.
do you want me to say it's good for the camera?
Yeah, let's just say. No, I know. So we can assume this was like a reminder to everyone. Like you think your teeth are very fine, but you are not. Because I was thinking my teeth are good.
Yeah.
But when I came and I realized like everybody needs a checkup.
Yeah,
So-
that's right. That's the problem with dental decay.
And how much would this cleaning process, like not fixing this, just the checkup would cost? If
Doing
it-
a checkup?
Yeah.
Today, if we were to bill you, we'd bill you for something called a spec exam.
Okay.
A spec exam means you come in with a specific concern. In your case, you just wanted me to take a quick look.
Yeah.
I think right now that's $48 for a spec
Okay.
exam.
So it's not that expensive. Like
No, I mean it's still not cheap.
Yeah.
$48 is money,
everybody should do it.
but it's a good thing to do. Yeah, lots of benefits to having the teeth checked. Yes.
At this moment, I'm feeling like I should change the title from the job to I'm fixing my teeth. I had a miserable issue with my teeth, and it would be like a big clickbait. Just kidding. Thank you so much, Jordan, for
Yeah,
that.
my pleasure.
And that was like a camera you.
Yeah, that's an
Can you
intro
show the
camera.
camera to the
Yeah.
camera.
Yeah, so
So
this is
your
a
camera?
new kind of tool that we have, and it's
Okay.
the mouthwatch camera, and exactly right. It has a light on it. What did you call it? The ring light?
The ring light, yeah. The
And
flashlight.
Exactly, and it
Okay.
allows us to just be able to take photos inside the mouth. So we have traditional extraoral cameras, but if you want to catch a really small detail like this thing is the way to do it.
Yeah.
All I could do is say you have cavities, but you
I
don't
can-
see it, you don't
yeah,
know.
Exactly.
Once I take a photo and I show you,
Now I think, yeah, it's really big. I need to fix it
yeah,
as
you can see there's these
Yeah.
big soft holes in your teeth that I can just go right
So
into.
is it like 2 pictures?
It's 2 different teeth.
different
I took about 3 or 4 photos on each tooth.
Okay.
Yeah.
So
there you go.
Go to your dentist and get your teeth checked up.
Yeah, I
You
really
don't know what you
recommend
have
that.
in your teeth. Even
Exactly.
I didn't
You
until
don't
I said
know.
this. Okay, so we have discussed about and I have checked my teeth. So they were not that good that as much as I expected. So
As we were hoping.
yeah, we were hoping, but it's fine. It's not that bad.
It's not that bad.
Okay.
I mean, we need the x-rays, but yes. Okay, not that bad.
That's what Jordan said to say in front of the camera.
Yeah.
They're not that bad. Okay. And what is the easiest part of your job and the hardest part of your job?
Oh, easiest and hardest part. I really like education. So like even now, when we're talking about what could happen, I like to educate patients on this is what happens if we do this, and this is what happens if we don't do this, and kind of talk about the options. I wouldn't say it's the easiest part.
So it is like a fun part to you, like
It's a fun part, yeah.
Okay.
Yeah, talking to patients and going over that and them understanding the options is fun.
Yeah.
I don't know, I can't say anything that's easiest. Likewise, hardest. There's a lot of things in dentistry that are challenging because you'll get a lot of cases. It's unlike a lot of jobs that can be a little bit monotonous, where you learn how things are done and it's just the same thing every single day. Every case is different. And there's always complexities with every single case. So if you like being constantly challenged, dentistry is good. Because you're always, like when I'm working, I'm always thinking about, okay, well, this is a unique situation and how do we resolve this specific problem for the patient? So there's a lot more active thinking and trying to figure things out.
And how are you paid? Like monthly, bi-weekly, or by patient?
It's a good question. Most new dentists, when they graduate, they work as an associate. So an associate means they work for a dentist that has a clinic. So they work for like an office that's already established. And those dentists tend to work as almost like a contractor. So they don't get paid bi-weekly, they don't get paid monthly, they don't get a salary. They get paid a commission based off how much work they've done. So in Vancouver, that could be 40%, 35, 40%. It varies depending on the office. So for like every $100 of work that they do, they would take 40 bucks. And then the office owner would have to use the remaining 60 to pay the staff and pay for the material and pay for the lights and all that. The bills,
Okay. So let's get to the best part where everybody wants to hear. How much? 1 second. Thank you.
There you go.
Okay.
You're free.
Thank you. So let's get to the best part where everybody is so excited. How much does a dentist make in a month in Canada?
It varies so
wide because as you told, like it depends on the patient, how many patients you get. Like an estimate, like a range, price range.
It varies so much. If you work out in, like for example, if you work in Alberta, where the fee guide is higher, and if you work in a rural setting, so you know, in a lot of jobs, if you work in a rural setting, you work away from the big city, you get paid less. But in dentistry, it's the opposite. If you're further away from a big city, because there's not very many dentists, there's a lot of demand
and supply.
So, so they will charge higher than the fee guide, and they'll get paid quite a bit more. I would, again, I really can't give you a fixed number. In Alberta, I have friends who will bill maybe $60,000 a month, and they take 40% of that. So they'll take what, 25?
45, like
give or take, right? In the cities, like in the city of Vancouver, it would probably be less, but I know dentists in Vancouver who bill that much per month as well. But I'd say that's on the high end, and a starting dentist might not be there. It really varies.
So like 15 to 20 for an average. No,
it varies so much.
I
think if you were to say 15, that's a very fair conservative number. I think that's conservative.
So for an year, it's more than like $100,000 at least.
Yes, I would say definitely they're in the high income. I would say 120, 150 is fair, especially if the dentist has been working for a few years, and you know, the longer they've been working, the more experienced, the faster they are, and so.
And the patients too.
And exactly.
So is it also like basis on the how much R do you put in? Because in India, I have seen like my mother going to a dentist, and it was billed according to the hours they put in. Like they were told like you will have to get 3-4 sittings, 6 hours, something like that.
No, I mean, again, every part of the world is different. Even in the US, it's different than what we do here. I know in the US, some places they do pay you per day that the dentist works, but generally here we bill by procedure code. So if I do a filling, and the filling is like one surface like that, even if it's very simple, or if it takes me 2 hours to do it, the pay is the same.
So it's like 10 minutes job or 2 hours, it's the same.
It's the same.
So that's like a different thing at that. And
Sometimes you get a really complex case, and it takes you a long time to do a good job and get that resolved. But you're still charging them the same as you would charge anyone else for that procedure.
Thank you so much, Jordan. And any other profession that you were interested in except dentist?
Before dentistry? I always wanted to be a dentist, but before I became a dentist, I did work as a teacher, and I found that was very useful for dentistry, because again, dentistry has a lot of education. So I really like that. I also worked as you could call it an academic advisor. I helped students apply for universities.
Like
Consultant, I would help students apply for university, so high school students applying for their programs. And I really enjoyed that too, because again, like educating and helping them kind of figure out their way. But mostly I've always wanted to be a dentist.
How did you get in the mind, like you want to be a dentist? Somebody told you it?
My father worked for someone who was married to a dentist, and so they were my family dentist, and she was a very good mentor. So she was a very good mentor, and I guess she just kind of instilled in me the desire to be a dentist.
That's good. And also, what profession would you choose if you want to switch now? Like, do you have anything else? Like, if I wanted to be this person, like, I want to change to this profession, or you would like, I know you are.
If I wanted to switch professions, I'd retire. I don't know.
Any other profession that you are intimidated towards? Like, yeah, I want to try this. Maybe like an actor, maybe like a reporter, news reporter.
I work at UBC as a teacher too.
You do.
So I was there today, for example. Nice. So I think if for whatever reason I didn't want to work in a clinical setting, I might still want to work related to dentistry, but maybe more on the teaching side.
Teaching side, okay.
Yeah, I do enjoy
maybe
that.
like a professor's kind of thing.
Yeah, kind of.
Teaching the same thing, but not practically.
But not practicing. Yeah.
Okay, and that was it, Jordan. Everything was so smooth, and thank you for your time.
My pleasure.
Really appreciate your time, because you are so busy in your schedule.
Yeah, well, we figured it out.
We had to like schedule it for like 2 weeks.
Yeah.
Like, he took his time, but I was not in the town.
Yeah.
And then he took another time. So grateful for your
pleasure,
time.
PIYUSH.
And just the last tip.
Yeah.
Any tip you want to give to the viewers to keep their mouth healthy? One quick tip,
I think a lot of people nowadays can be concerned about using fluoride, because it just sounds like a scary word. There's a lot of good evidence, especially with kids, but at all ages, there's good evidence showing that fluoride really helps. So when you're buying your toothpaste, look for a fluoride toothpaste.
So because in India, and also like there's so many advertisements that says my toothpaste has salt in it.
Yeah.
So like, is it beneficial?
No, things like that. So salt, sodium bicarbonate, so baking soda. Anything like this is really abrasive. So people will use that to brush, and their teeth will look nice and white. But it's white because it's abrading, it's polishing off your tooth. And so that can actually, over time, it damages the teeth, it causes sensitivity. I mean, it can actually make your teeth go yellow, because that inner layer of the tooth is darker. So when you first brush it, it looks nice and white. But if you keep brushing this, you brush into the yellow and it gets dark. So there's a lot of downsides to using these really abrasive agents. I would recommend avoiding it. Things like charcoal, baking soda, that's...
Baking soda, and I've also heard about like turmeric.
Yeah, again, there's not good evidence to support it. There's lots of good evidence for fluoride. It's not a fun thing. Everybody's known it for a long time. It works. You know, don't go crazy. Don't put a ton of fluoride in everything, but a normal fluoride toothpaste works well.
And brushing twice a day is also...
Twice a day, and flossing.
Thank you so much, Jordan.
You're welcome.
Thank you so much.
Yeah, my pleasure.
Thank you. So this was my time with Jordan in his office, and I hope you liked the video and it was helpful. अभी मैं इंग्लिश में बोल रहा हूँ क्योंकि वो थोड़ा एक्सेंट सा चढ़ गया जुबान पे, तो भाई थोड़ी सी समझने की कोशिश करना, कैप्शन ऑन कर लेना, होपफुली तुमने कर लिए होंगे, अगर नहीं करे दोबारा जाके कर लो. So वॉच द वीडियो और शेयर करो जिनसे तुम्हें लगता है हेल्पफुल हो सकती है. एंड इस वीडियो में सिर्फ प्रोफेशन के बारे में नहीं, टिप्स भी बहुत थी, मेरे को भी मिल गई कि हाँ भाई स्टे हेल्दी, मेरे को बहुत ज़रूरत है. तो आई नो यहाँ बहुत महंगा पड़ेगा, बट फिर भी ठीक है, $50-60 अगर मैं यहाँ लगाऊँ तो. सो लाइक से सब्सक्राइब टू द चैनल, एंड और भी वीडियोज़ आएंगी, और भी मैं प्रोफेशंस को कवर करने की ट्राई करूँगा जब तक कर सकते हैं, वरना इट्स फाइन. सी यू, बाय. लाइक से सब्सक्राइब, लव यू ऑल. तो आप हो चुके हैं फाइनली फ्री, एंड इट वॉज गुड टाइम. एंड भाई बीइंग डेंटिस्ट, और कोई भी जॉब मैं कहता हूँ, छोटे से छोटी, बड़े से बड़ी, तुम चाहे प्रेसिडेंट हो, यहाँ प्रेसिडेंट पता नहीं, शायद वेला हो तो पता नहीं, प्राइम मिनिस्टर ट्रूडो था ही वेला, बाकी और भी कोई जॉब हो, यहाँ पे किसी के पास टाइम नहीं होता. सो अप्रिशिएट इट अनफ, कितना भी करो, अगर कोई तुम्हारे लिए यहाँ पे टाइम निकाल रहा है, सो इट मीन्स यू आर समथिंग टू हिम. सो इट वॉज गुड, एंड ऑल्सो इज वेरी नाइस गाय.